can start recording. Yes. So welcome all of you once again. Oh, some people say they can't hear me clearly. I'll try to speak up a bit. Today we want to discuss disruptive mood dysregulation disorder. When we started with the mood disorders series, we mentioned that under mood disorders, there are subsections or subsets of disorders. So we started by looking at depressive or depression, general or major depression. We looked at that in the first week of the series. We also continue to look at bipolar disorder and its subtypes. The last week, we look at premenstrual dysregulation, premenstrual disorders.
Well, maybe she should be running this since you can't seem to get under control.
And today we're looking at disruptive mood dysregulation disorders. I want to ask if anyone has any idea when you talk about disruptive mood dysregulation disorder, whether you've heard it before or you've seen someone, what do you know about it? If I can get some one or two reactions to this before we continue. You can raise your hand or you can also put in the chat box if you have. And I don't know if it is only Ahmed who is having challenge in hearing me or it's a general problem. If it's a general problem, please let me know.
I can hear you, please.
All right, thank you very much.
I can also hear you very clearly.
Okay, then Ahmed, I will suggest you maybe reposition yourself. Maybe the network at the end might be causing the difficulty in hearing. Today I'm using my phone too, so I'll be sharing screen with Madam Claudia. She is sharing her screen with me. Unfortunately, my laptop has broken down. All right, so I asked a question, whether you know of disruptive mood dysregulation disorder. Have you heard it before? If you've heard it before, what do you think it is? If I can get some volunteers to share their views with us. Oh. So the topic is new to everybody here. Okay. We'll go ahead with it. So basically, disruptive mood dysregulation disorder affects children. Children, that is, Madam, you can get the first slide on what is disruptive mood dysregulation disorder. Good. I think it has been zoomed too much. You can zoom it down a bit. Kindly forgive us with today's presentation.
Hello.
All right. Yes, hello.
Yeah, my network was distracting. It's like you made mention, you asked us something. My network was disturbing. Now I'm stable.
Okay. Yeah, so you can share your views with us whilst we continue.
Come again.
So the question I asked was whether you've heard of disruptive mood dysregulation disorders before. And
Yes.
if you have, can you share your knowledge with us before we continue? Yeah, so that is the question I asked.
Oh, okay. I think it's a childhood mental mental disorder that is characterized by the child. You see that the child will be outburst, and then in severe form.
Okay. When you say
Yeah.
outburst, can you explain a bit of what outburst is?
He speaks with anger, and those he speaks like with anger and those sort of things.
Okay.
Yeah.
All right. I think when maybe somebody may want to add on to what, but you didn't give us your name.
My name is Norbert.
All right, Norbert. Yes, Norbert. Thanks for your contribution. Yeah, maybe somebody may want to add on to Norbert's contribution before we continue. So let's build on Norbert's explanation. So Norbert made us to understand that it's a mood disorder, and he mentioned anger outburst. Mentioned the child is very angry. Yes, so as I mentioned earlier, mood dysregulation disorder mostly is a condition that affects children, and then children or adolescents. Okay, children or adolescents. And when it happens, the mood that a child displays is kind of said to be overly done. So on our screen, we have disruptive mood dysregulation disorder. I would like to appeal, if you're not speaking, you mute for us so that you don't get distracted. Disruptive mood dysregulation disorder is a childhood mental health condition. Yes, to blind the childhood mental health condition, which is characterized by persistent irritability. So the word persistent is very necessary over here because it differentiates this very disorder from other mood disorders like bipolar, and then even sometimes, especially talking about children, you're not careful, you may be mistaking it for attention deficit hyperactive disorder. So I want us to take note of the very key words that are in here. One, we are saying that it's a childhood mental health condition. And then secondly, we are saying that it's characterized by persistent irritability. So talking about irritability, persist like they easily get angered or irritable. Anger. So their anger can be so persistent and it's like uncontrolled. And frequent, intense temper tantrums or temper outbursts. Children commonly experience periods of moodiness, but those with disruptive mood dysregulation disorder and with severe symptoms that significantly impact their daily lives. So you see a child, 6, 7 years, getting so angry and distracting almost everything around them. Their kind of anger is just unimaginable. The things they do, this child will do when they become so angry, it's so severe that you be asking yourself, is this a child? This person did this thing, is this a child or is an adult? They get angry to the core, and their behavior is so unthinkable. So basically, as you are saying, as I said, it affects children or adolescents. Somebody may say that, but children have this bad mood and other stuff. Yes, those mood things in children, tantrums and those things, yes, they are possible. But the situation you are talking about here is that the child persistently becomes angry, and which is disproportionate to the situation. Although what I'm angry, you wouldn't really understand why they should be behaving that way. And it's a very severe form of thing and very persistent. It's something that happens very, very frequently. And you realize that This will be happening within or more times per week. So within just 1 week, this very extreme form of anger, irritability, distractibility can be happening. This child will be displaying this thing within at least 3 or more times in the week. And then you're also saying that the outbursts and the tantrums have to be present regularly for at least 12 months. So we don't just consider a child who is displaying these anger issues within just how do you call it, a month, some few days. We are not able to say that this child has this condition. We are saying that at least this condition or these symptoms, this behavior should be persistent for at least 12 months. Please, let's look at the next slide, please, Madam Claudia. Yes, so if you can zoom a bit. We are trying to look at some symptoms that children exhibit. So one is that the kind of irritability that this child brings up happens almost every day. An irritable or angry mood most of the days or almost every day. That this child is exhibiting this severe form of anger, irritability, or tantrum. And sometimes they present these things like either in the behavioral way or verbally. The child, a very young child, can be so verbally aggressive, abusive at a time, and it is persistent. Something just very small, something that you shouldn't even think this child will be behaving like this, but they may end up behaving like that. And then the second is saying that severe temper outbursts, that is either verbal or behavior, that are out of proportion. That are out of proportion to the situation. This usually happens 3 or more times per week, which I've mentioned earlier. And the underlying word here you're talking about is out of proportion. The way that this child is behaving compared to the situation at hand doesn't really make sense. And then issues with daily functioning due to irritability in more than one environment, such as at home, school, with peers. And so one thing that can also differentiate this condition is that the behavior happens not only at one situation. So in this case, we're talking about not only at home, maybe where the parents are, but the situation that happens, whether the child is at home, whether it's at school, or even playing with peers, the anger outburst can just happen like that. And sometimes they can do things and get themselves hurt because the behavior that they put up gets out of proportion. Very intense form of anger. And then the tantrums that they're putting out there. Looking at the child's age and what they are doing doesn't really correspond. So basically, that is what we are talking about. Yes, over here. So let's look at the next one. But usually talking about the diagnosis, usually you look at it between the ages of somebody may ask, so around what age should we consider a child having this thing as a problem? So usually according to the DSM-5, the ages of 6 and 10, and then not more than some people put it not more than 12 years. Where you put this, but mostly between 6 and 10, when these anger issues are happening, this diagnosis here. So the child must experience the symptoms continuously for at least 12 months, as we mentioned. And then over time, as the child grows, as the child can develop, the symptoms of this condition may actually change. So, for example, an adolescent or a child with this condition may experience a reduced tantrum, maybe fewer tantrums, but they may begin to exhibit symptoms like depression, or this condition exists in the child and is not taken care of. As they grow with it, it will be degenerating into other mental health conditions like depression or anxiety issues. So for this reason, treatment may change over time. So when the therapist gets to know about the child's condition and they are taking care of the child, they also follow up through the years as the child ages. So sometimes there are some common things that may trigger this anger outburst in children. I'm getting a message that there's a lot of echo from my end. I don't know if it is the same for everybody.
No, I'm not experiencing it.
Okay. Yeah, so I was talking about common triggers for disruptive mood dysregulation disorder or this anger outburst. All right, very good. Some people say they are not experiencing the echo, so I guess the network from the other side. These children sometimes, when their routines are disrupted, or the way their daily things that they do, when there's a change in it, maybe the color of the spoon they use, if you change it, can make this child bring up some form of anger that you can't imagine, or a dress or something that they like, that or the routine that they've been using every day. If there should be a change in their daily routines, some of these outbursts may come up. They may start presenting some of these outbursts, and it can be very, 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 very disturbing. Until they get what they are expecting, they don't stop. So this is one thing that makes it different from attention deficit. You know, the attention deficit, that one, whether the person gets the situation, once the attention shifts away from the thing, within time, they seem to forget about the whole situation. But with this one, until they get what they need, their minds are still there, and they will cry, do all sorts. Sometimes they can even catch themselves, use their head to hit things, and do all sorts of stuff, because you change their routine for them. Things that they know that they are supposed to do, they kind of being changed. Sometimes when there are sensory overload, noise, where there are noise, crowds, maybe too bright lights or darkness, sometimes it may trigger some of these anger outbursts in these children, and their behaviors become ways that are unimaginable. Sometimes too, when they feel frustrated or they feel not tolerated, so frustration, intolerance, they don't actually tolerate frustration, making things difficult for them is something that they really don't like. So if you want to frustrate them a little, sometimes you didn't say something is happening to them. They hate frustration. Or if they are finding it difficult to solve a problem and they are not able to solve that problem. Let's say the child is trying to put his or her bone inside their bag, and they are finding it difficult to get the bone into the bag. And it seems to be difficult putting that bone in the bag. That alone can bring about a whole gymnastics, where they will display, and sometimes you just don't even know what to do. There's also when they are hungry or when they are tired, fatigue and hunger can also be a trigger to this outburst. So these people, they need good sleep. Maybe you didn't get a good sleep, or you didn't give them their, because as you said, they are routines. They want their routines to be followed. So the time they take their meals, if it is skipped, some of these anger issues will pop up. Where there are miscommunication or conflict among their peers, because they have these social difficulties, it also brings about some of these anger outbursts in these children. And it's something that, and a lot of factors, anything that will change their mood, anything that will make them feel not heard, anything that will disturb them, that will make them feel some kind of difficulty can be the trouble for the whole day. And as you mentioned, it's a persistent thing. So these behaviors continue, not once, not twice. Continuously be happening. So it's not that it comes in episodes. When it comes, it continues, so they decide to stop. So mostly children with this condition have trouble in school and difficulty maintaining a healthy relationship with families and peers. So they also have it, they find it hard time participating in social activities, maybe sports. They can be doing some sports in school and somebody provokes them and their whole atmosphere is going to change over there. They can hurt their colleagues or do unthinkable things to their colleagues just because they got angry. And sometimes they can't be controlled. If the teacher are not careful, they really know what to do. Sorry, why I never like coming in. Sorry for that. Next slide, please. Yes. So this behavior or this emotional outburst sometimes follows a cycle, which we call the disruptive mood dysregulation emotional cycle in that child. So there may be a small trigger, like noise that we mentioned, like some frustration, change in routine, hunger, anything. Just something very small happens, and then that nervous system or overload activates. The energy come up, like it becomes so tense up. Then there's a bus where they'll be doing all the gymnastics, hitting things. If they didn't get bottles, they'll break bottles, hitting people, hurting themselves, rolling on the floor, and all those behaviors. And if you are trying to control them, it's very difficult to be controlled, or they become very difficult to control. And after some time of their own behavior, they feel so guilty and they become exhausted because the energy they put in the behavior that they are bringing up is intense. So they become exhausted. So the cycle starts from the trigger, then the nervous energy activating the explosive behaviors comes, difficulty calming them down, and soon they feel so guilty of their own behavior, or they become so exhausted. Sometimes they can be on the floor there and fall asleep. they can be crying and fall asleep at wherever they are. And then maybe there will be some break. Another trigger sets in. Then the whole cycle starts again. And it follows like that. So that is how it moves. So people or children who have this issue, that cycle typically follows. The cycle typically follows. Somebody may say that, so how do you know that this is a normal child behavior, and why is it, and when do you say that this is becoming a problem? We mentioned from the beginning that the severity of the behavior they put up, the consistency or the persistency is something that we are looking at. So all students can actually become irritable sometimes, which is very normal, which is very okay. And it's a normal reaction to frustration. If you are making a child frustrated, they'll cry, they'll do all those stuff. But children experiencing severe irritability have difficulty tolerating frustration and have outbursts that are out of proportion to the situation at hand. And these outbursts occur more often and are more severe than expected for children of their age. So let's take, for example, a parent tells the child to stop playing a game and do their homework. Any child might be frustrated or annoyed because they are taking their play away from them. Something that is making them happy, they are taking it away from them. So they will feel some way and put out some kind of few tantrums and all that, which is normal. I'm even sure it out that you are doing something and you are asked to stop and do another thing, you feel some way. But a child with disruptive mood dysregulation disorder may become extremely upset compared to a child without it, and emotional, and have an intense temper outburst with yelling or hitting. So they can be yelling and hitting simply because they come and do your homework. They can smash the door, bang the door, hit whatever. This child doesn't need care, using something to smash your television on the wall. Because when the anger comes like that, looking at the cycle from the explosive state, anything is just like intermittent explosive behaviors. It explodes and they don't think of any other thing again. So a child with this condition experiences this intense temper outburst a few times in a week, and as we said, sometimes 3 or more times in a week. Please, let's look at the next slide. Hi, Madam Claudia, please move to the next slide for us. Good. Risk factors related to the development of disruptive mood dysregulation disorder. With this, I want parents here to, or members here to contribute. If we are talking about disciplinary problems or school issues or poor parental support, how do you think this can affect the child and make the child develop these conditions? Parental guidance, parental control. I want us to share knowledge before I come in with my explanation. So if anyone can share the role of parents in making a child develop these conditions, I want us to share some views before we continue. Yes, who is taking a first bite for us?
Please, Please, I want to speak.
Yes,
I'm
Madam
Rita.
Rita. Go ahead. Sure.
Yes. And when it happens that you overpamper, when a parent overpampers a child, and all of a sudden, I mean, while you overpamper the child, anything the child does, you see it to be good, and all of a sudden you decide to try and correct the child when the child errs. That one,
Okay.
they will not take it lightly, and so they tend to behave this way. Thank you.
Okay. But I think if you can come more clearer. So how do, yes, the child not taking it lightly, but how will a parent's behavior or way of upbringing this child affect the child developing this condition, or that will cause the child to develop a condition like this?
Like if that when the child is young and you refuse to correct the child when the child is going wrong.
Very good. Yes.
When it's time, when you feel that it's now time for you to correct the child, it won't agree.
Exactly.
And so the child, there will be like some sort of rebellion, or if I may put it that way.
Yes. Very good. And that is very true. Yeah, so who else will want to add his or her voice to how parents can be contributing factors to this issue? Oh, we are interacting.
So are we still with the poor parental support, or
If you have any other thing that you think can cause a child developing this condition?
I think we can relate it to the parental hostility. When we are hostile to the children, a child comes from school, or a child is growing up and the child wants love, wants to talk to mommy, daddy, and then we are hostile to them. Oh, I'm tired. We push them away. We don't want to listen to them, and beating them. And then listen, you beat them, you scold, you do. There is no love. It's also a risk factor. Just want to add to what my sister just said.
Yes.
Thank you.
Very well. And that is very true as well, Madam Irene. Yes, who else want to add?
Hello. So I don't know if this is an addition or it's a question. So ADHD, there are times if it's not properly managed, the child can develop similar behaviors. So can we say that is also a contributing factor to this condition?
So you see, usually we can put ADHD as a comorbid disorder, talking about other conditions that may come along with. But attention deficit is a disorder on its own. So whoever is in a diagnosis must be able to distinguish it properly that this behavior is attention deficit or it is this disruptive mood dysregulation disorder. They are not the same. So it may not be that this is bringing about this. I don't know if it is clear. There are two distinct conditions. That's why in the diagnosis you are to differentiate why you think this is not attention deficit, but it can be a comorbid disorder as well, or a comorbidity. I hope that is clear.
Yes, it is. Thank you.
All right. Please, any addition?
Hello.
Hello.
Yeah, please. With a poor parental support, I also want to add that probably if a child's needs are constantly unmet most of the time, I think it can also contribute to the child developing this kind of condition.
It's okay. Yes, when the
And
child
then,
needs are constantly unmet. All right.
yes, and then family conflicts too. When the child is in an environment, there is always conflicts. There are problems. There is fighting, quarrelings here and there. It can cause them to also develop this kind of conditions. Thank you.
Yes, yes, and even family conflict where parents are always fighting before the children. This can also be contributing factors, just as you rightly said. So sometimes this condition may not necessarily be biologically, maybe by the home environment, the kind of exposure this child has, or even exposure to trauma, abuse, neglect. All these can be contributing factors. And then, as I think the narrator or someone mentioned, that inconsistent parenting style or the unresponsive caregiving, where parents are inconsistent. At one point, they are following the rules. At another point, they are bending the rules. And there's no clear cut, making it hard for the child to develop this emotional regulation. Sometimes can also be contributing factors. Harsh parenting styles too. So the child may now become rebellious. So a number of factors. And you mentioned parental hostility, where you are always beating this child, hitting a child, and especially when there's conflict in a marriage. And then one person is displaying the anger on the child. When these things continue like this, sometimes they can become risk factors. Disciplinary problems at school, substance use by the parents. So when the mother or the father uses drugs or alcohol and some of this stuff, and the child is born, this can translate into the child's behavior. Somebody may ask, how come a father's use of substance affects the child? The question I want to ask back is that how come do we have alcohol withdrawal syndromes happening in children? So sometimes parents' use of drugs can affect the child right from the womb before this child is born. And the man should also know that the man you contribute sperm. So if the sperms are infected with substance and it fertilizes, the substance goes through there and forms the child. So this child grows with effects of substance use. And worse of it, the mother also uses the drugs and alcohol in particular. So a parent who uses these drugs or alcohol has the tendency of causing some form of medical or mental health issues to their child. Sometimes it can be physical disability to the child. So parents should be guided when dealing with situations like this. Please let's continue. Madam Claudia, can you move to the next for us? Yes. So now we have what we call the oppositional defiant disorder. And if we are not careful, mistaking that disruptive mood dysregulation disorder. So I just got this so that we are able to get some differences and some similarities. I'll also talk a bit on the ADHD aspect. So I'll use the word DMD for the disruptive mood and then the ODD for the oppositional defiance disorder. So you take DMD, as we already said or established, this behavior or these tantrums or these irritable anger issues are consistent. It's something that happens very often, very, very often. When you take oppositional defiance disorder, it happens periodically. So there are sometimes this child will calm, and then sometimes we show the behavior. But the two of them involve difficulties with emotional regulation. However, when it comes to the emotions, they are very severe and chronic. While ODD often displays anger and there's a difference, they may not go that bad. They'll be angry, withdraw, not wanting to talk, a bit verbal abuse, but they wouldn't go to the extent of hitting, hurting themselves, or those extreme behaviors. But with the DMDD, the behaviors can be very extreme. With the DMDD2, outbursts are typically triggered by frustrations or perceived injustice, which we've mentioned. When it comes to the oppositional defiance disorder, behaviors often respond to rules or requests. So it depends on something where they are not obeying rules that are laid down. So if you say A, they rather want to do B, that's we're talking about defiant behavior, oppositional defiant behavior. They don't follow rules. So this condition, for instance, if it's not taken care of properly, it can lead to this child becoming, how do you call it, some of these psychopaths where they don't feel for people, they do cruel things. And sometimes it is helping to form a personality type in them, which next week we'll be starting with personality disorders. So we'll go into that aspect too more. You see how some personality disorders affect or come up through some of these things. But both DMDD and then ODD, both exhibit and oppositional behaviors. But DMDD has temper outbursts disproportionate to the situation, while ODD involves defiance, disobedience, and hostility towards authority figures. So they disregard rules and regulations. But with the DMDD, it is more about the anger outburst. With DMDD, symptoms typically emerge in early childhood. As we mentioned, 6 years, 6 to 10 years, you see this behavior. So like this small boy, this small girl, that kind of, when they are angry, what they do, like you look at it and it's like you don't even understand. So we are trying to let everybody understand that there's a condition like this that affects children. But when it comes to the ODD, behaviors become more pronounced during the preschool and elementary school years. So 12, 13, or 10, 11, 12, thereabouts to 15. You may be seeing some of these behaviors over there. But with the DMDD, it starts very early. But both disorders may interfere with their social interactions, academic performance, and general well-being. It has a tendency of causing that. And then I was talking about the difference when it comes to attention deficit. So one takes attention deficit and then the DMDD. With attention deficit hyperactive disorder, there is inattention. This is the person is unable to pay attention to a particular thing. So they are doing this minute and they turn to something else and they've forgotten what they were even doing. They are not able to pay attention. Even in the classroom, the attention span shifts so quickly, so fast. They can be hyper, like that hyperactivity. The person may be hyper but may not be angry. And then also they have that impulsivity. They are impulse driven. Whatever comes to mind, they do it. They don't control. So with attention deficit, that was mentioned by one of our contributors. It's more about the inattention, the hyperactivity, impulsivity, and those ones. Sometimes there can be intense emotions as well. Okay, intense emotions are there, but they are not as consistent. They are not that consistent. It depends on something that is provoking them. So maybe the whole week that emotion may come once, or it may not come at all. But when we talk about the disruptive mood dysregulation disorder, with that one, the underlying thing is the anger or the temper outburst. Not necessarily about attention or inattention or being hyperactive. They may not be hyperactive. They may have the attention spans okay. But when they are angry, when they feel frustrated, you can't stand it. So there can be that severe and frequent temper outburst. A very pervasive one. And it is persistent as well. And when it comes to the attention deficit hyperactive disorder too, with this, outbursts can occur, but it is not frequent. But with DMDD, the outbursts are very, very frequent. And you mentioned that more than 3 times in a week. And it is disproportionate to the situation. However, any of this can have an effect on their performance academically. Please, do we have any slide next? Let's check, Madam Claudia. Okay. Yes, this session was supposed to be a very brief one. No, let's stay where you are. Let's look at what are the signs and symptoms. We take some additional signs and symptoms. So as a summary of 8 here. So I say that children or adolescents with DMDD experiences severe temper outbursts, often on average 3 or more times per week. Outbursts and tantrums that have been ongoing for at least 12 months, we've mentioned those things. Chronically irritable or angry mood most of the day, nearly every day, mentioned. Trouble functioning due to irritability in more than one place, at home, at school, or even with peers. All right, please let's move to the next slide. But one thing you should know is that this condition was not in the previous DSM. Diagnosis which have been introduced in the DSM-5, the current diagnostic and statistical manual for mental health. It's a new diagnosis. So previously, children who are experiencing this condition in the past, either the child is considered to be experiencing either attention deficit or something else. But with research and other stuff, experts have come up with this diagnosis. And that is why you don't diagnose children as depressed, like depression, anxiety related. So you look at sometimes maybe around these mood dysregulation issues. So how do we support a child with anger issues or anger symptoms? So some suggestions are here. We mentioned some things that can cause it, or you mentioned something that can cause it. The very thing is that now that when you know the cause, preventing or controlling those causes can help support the child. So at home, so I'm going to open this. These points are not limited to what can be done to support or prevent the situation. So at home, create predictable routine for stability. We mentioned earlier that when routines change like this, it affects them. When their daily routines change and it's like they are not in control, things are not in order as they know it can bring about this anger outburst. So if you know your child has a problem like this, you try as much as possible to keep their routines on. Keep their routines on, and it can be helpful to them, because as you keep changing routines and other stuff may affect. But to prevent it from even happening at first, try to regulate the routine so that the child doesn't get used to, oh, this particular color, this is the color of my spoon. This is if you vary this thing, the child do not become accustomed to a particular routine. Because if they become accustomed to it and you are changing it for them, it becomes a problem to them. So it can be a tip how we can prevent situations like this. And if the child already has a problem, you mentioned that noisy environment can be disturbing factors to them.
Baba, you have to buy for the materials.
So,
They are there. Then tomorrow morning we'll be running a custom. Ajara.
So you try as much as possible where of noise you are able to take the child away from that place. Sometimes heavy crowds trigger some of these outbursts in them. So you try and know how to manage things like this. Where there are heavy crowds, you take them away from them because the tantrums may come up so severe in situations like this. So I say that at home, try and create predictable routines for stability. With friends, teach their emotional skills through role play as well. It was just, I don't need to say coincidental that today at church where I fellowship, the whole sermon was about effective parenting. And so maybe I may want to share some of these tips that were very helpful. And I realized that these things could also help prevent some of these issues in children. So, like for instance, setting healthy boundaries for children, establishing household rules. This is how, so we put the rules over there. The child knows that this is the time we do this, we do this, we do this. We don't go here, we don't insult an adult. So once these rules are there, and the child is growing with them, they become used to that a child must not insult an adult. A child must not disrespect an adult. And also define acceptable behaviors and consequences for crossing those boundaries. As parents, define acceptable behaviors and consequences for crossing those boundaries. Train a child about honesty, respect, and kindness. So as they are great, sometimes you feel like the children are so young that some of these things they don't understand. When you demonstrate it to them, they pick it up. So you know that your children are like how you put up yourself, because they see you and you are their number one role model. So when it comes to communication too, you teach them how to speak. So setting some of these clear boundaries help. You teach them to respect, like when it comes to siblings. You try to develop healthy sibling relationships in them, where you teach them to respect each other and also respect each other's views. Encourage cooperation and teamwork among siblings. Promote empathy and understanding among them. And also establish fairness and equality within siblings. These are just a few tips that I wanted to share from the message that I got today. Atomic Hills English Assembly in Accra. And at school, the request accommodate movement breaks. If you know your child houses, you can let the school understand. But first, it will be good you also take your child for assessment. See a professional psychologist, any mental health worker. They should take this child to assessment and see whether this child falls within this category for us to be diagnosing. And then once that is identified, intervention plans will be put in place. When the child is going through these behaviors, tantrums, they stay calm. Just be calm. They will come back. What you need to do is just watch and make sure that they don't hurt themselves. But they will surely come back. Embrace them after they are going through all those things. Show them love. Show them still there for them. Despite whatever they are going to, you still care for them. You still love them. Caning them or beating them wouldn't change anything. Even that is going to increase the situation the more. It will increase the situation the more. So hitting them will not actually change anything. You can teach them breathing exercises, breathe in, breathe out. You can teach some of these and train them when they are sometimes in therapy, they are able to train this child. If you see yourself getting angry, count 10. At the count of 10, the anger may come down. Or you teach them some activities that they should do. Breathe in, or they channel their anger into something productive. So seeing a therapist can help train this child, or even the parent. The parent is guided as to how to manage the child. So don't say, oh, my child is just stubborn, my child is just this, and leave the child. No, this child can benefit from therapy. One thing you should know is that this condition usually doesn't come or may not come with psychotic symptoms. So we may not, like, it's not about the child hearing the voice or anything scaring them, or no, it's just the so as the child is going to see this relaxation exercises, like the progressive muscle relaxation, and all that stuff, mindfulness, relaxation, guided imaging. These are all therapies that are available to help calm the child. So now my question to the house is, in your own way, what do you think you can do to prevent some of these things developing in children? Or if you have any experience with this, you can also share with us. So let's get interactive. You can unmute your microphone and speak to us. What's the name? Dawood Ahmed. Can you share the experience with, as you said, you are experiencing this situation? I don't know if you can share, unmute and share your experience with us so that we all learn from it. Adri Hashid Dawood Ahmed. Okay, Brenda says, give the child the necessary attention he or she needs. And so, Brenda, the question is, so how much attention should be given to this child? Because let's also know that over attention can also degenerate into something else. Over pampering of children can also degenerate into something else. So we have to be careful. You say necessary attention. Okay, maybe that's an underlying word there. Necessary attention. Give a child the necessary attention, but it shouldn't be too much. There are parents, unless the child doesn't say anything this child wants, they are giving. So the day that they ask and it is not available, they start to put up some of these behaviors. So parental guidance is very, very necessary, and we shouldn't overly do some of the things. Some parents are overly protective, and then some overly protective. So they've given all the freedom to this child, and other. Yes, please. What can we do?
Hello.
Hello.
Yeah, please. For the prevention, I think we need to do more education on the condition so that more people or more parents would be aware of it. One of the causes we talked about was substance use, so that adults would regulate or probably even stop abusing substances, knowing very well that it will affect the next generation. And then also, when we do more education, we can even do it in schools so that caregivers in the schools can also be aware of the condition. Then they may be able to pick up children with these issues and probably engage the parents on the issue as well. Then when the education is also extensive, it would let parents know how to control their children or how to care for them properly, balancing between giving attention and then disciplining them as and when necessary, so that this situation can be kept. But I have if you can elaborate on movement breaks accommodation that you talked about. I didn't really get it. Thank you.
Thank you. You're welcome. Oh, okay. You're talking about request accommodations like movement breaks. Oh, okay. Yes, so this is measures that the schools can. Because we are talking about this child sometimes having the difficulty with changing of their routines. You let the school understand that this is the problem my child has, like you mentioned with the advocacy in school. So when teachers get to know that this child, this is some of their issues. Now the child is made to understand when it is break and when it's not break. When they can go out to do this, when they cannot go out to do this. So that is the movement breaks, request accommodation like movement breaks are talking about, so that they can make the necessary adjustment. This is a child who has the problem already. That's what they're talking about. A child who has this problem and in school, school authorities are to help by ensuring that routines are organized for the child so that it doesn't cause some of these anger outbursts. Because maybe this child is not yet time for break and the child wants to go out. If the child is insisting, sometimes you may end up allowing the child to go. But with time, when the child gets to know this is the time we do, this is the time we do, they end up falling in it and then going accordingly.
Oh, okay.
Yeah, so
Thank you.
that is what that point is. And very laudable point you mentioned, the advocacy. Yes, so when we started this very evening, it seems most people don't really know about the condition. So it is good we are talking about it. And as you've heard it, also tell more people. And at Springboard and Ghana Growth, we are always open. In case you want this advocacy for your group, you can reach out to Madam Claudia or any of the admins of the Ghana Growth program or Springboard, and will come in to support you as well. Yes. Please, are there any other contributions? So let me just add some strategies. I've mentioned some of them already, but I'll just go through some few strategies for managing outbursts. So if you're a parent and your child goes through some of these anger outbursts, I mentioned earlier that you should learn to stay calm. So during the outburst, just be calm and try to diffuse the situation instead of escalating it. So instead of shouting at the child or trying to do, you yourself getting more angry, you escalate the whole thing. So know that this is a problem your child has. Remain calm. Even when because when you look at the cycle made us understand that time will come that they feel so guilty of what they are doing. Sometimes they become exhausted. At that moment, give them love. Let them understand that, oh, you shouldn't have done what you've done. However, you understand, then you try to negotiate with them. Get them calm. But if you want to rather incite them more, the cycle is going to repeat, it's going to continue. And because maybe something you said that will provoke them will start the whole cycle and to be going around like that. So if you rather be calm and diffuse the situation rather than escalating it. Avoid trying to reason with the child when they are in the middle of an outburst. You never win. Whatever they are challenging you for, in the middle of the outburst, you can't win. So don't try to give any reasons or judge them in any way, because they can't reason properly at that point. Just be calm, as you said. Allow them to go to the episode. It's just like a seizure disorder. When a person is going through the seizures, you can't do anything to stop it until the seizure itself stops. All you have to do is that you protect, you be around the person and ensure the person doesn't hurt him or herself. So the same way, when a child is going through that episode or the cycle, just remain calm, because at that time they can't reason with you. Logic is far away from them at that point. So when they settle, then you cannot reason with them. Empathize. So use empathy to help the child feel understood and cared for when they settle. Guide the child through sensory experiences or calming techniques like that, debriefing or counting that is mentioned. So let them count up to 10. We start again. Breathe in, breathe out, breathe in, breathe out. Close your eyes, breathe in, breathe out. Some of these things can be helpful. So help them to identify and manage their emotions before they escalate. And it is very necessary. I see one of the charts. It says that we should know the triggers. So as your child, you must understand what triggers. That's Elizabeth. Sorry if I didn't get it right. He said you should recognize or understand first what triggers the behavior. Yes, as parents, you must know your child and then learn to recognize situations that might trigger an outburst to better manage them next time when they are going through this thing. It's very, very important for parents. And I mentioned earlier that let us set clear boundaries. So let a child know what you expect of them. Work with your child to establish consistent routines as well, which was well mentioned earlier. Reward positive behaviors. So when a child does something that is right, consistently reward positive behaviors to reinforce them. So if the whole day they were able to stay without any outburst, you can appreciate them. Oh, today you've been so wonderful. I like how you were there without any anger or all those things. Let them feel that, oh, they did well. So next time, because they know if they're able to live up to this standard, they may get a reward. And it can be a way of shaping and correcting a behavior. So you can use reward positively, and provide emotional support too. Help your child to feel valued and understood by offering support and encouragement. But sometimes you can't do it all alone. So you have to seek professional guidance. So you consult your mental health professional to get a comprehensive analysis of the situation, and then they'll provide individualized treatment plan for the child. Maybe through assessment, they may want to recommend some forms of treatment. That way, based on the professional that you are seeing. Then, as you are doing here too, is educate yourself. After this meeting, read more. If you go online, there are a lot of information. Those who are on the Care Corner platform, yesterday you mentioned that people should read ahead so that they get to know more. So that when we are discussing it, you can understand it better. And then the advocacy too will continue to do it. So tell a friend to tell a friend about it. Madam Claire, do you have any slide again? I guess that's all right. Okay. Yes, so we'll be ending today's segment here, and we are open for questions. If you have any questions, please, it is time for us to interact. I am done with my presentation. It can be based on previous presentation on the mood disorders. What we did last week, you can ask questions or anything about today's poem too. But I want you to understand that this is a Ghana Growth Program, an initiative of Mastercard Foundation, and this is the Care Corner, part of the e-counseling session. And my name is Jones Kwesi Tagbor. Yes, please, do you have any questions? Unmute and talk to us. Yeah, Augustina says, thank you so much for the presentation. It was very insightful. Thank you, Augustina, and thanks for your contribution as well. And I want to mention that I didn't prepare slides today. So we just use some of those artworks to support. So I don't have a slide to share, but the recordings are there that we share. I mentioned earlier that my laptop is spoiled, so I couldn't prepare slides. So those who will be asking, you need a slide, I don't have. But later on, the recordings will come. Okay, there are no new questions in the chat and there are no hands up either. So as a way of announcement, I want to announce that Springboard is ending its nationwide conference, youth conference, comes at UPSA Auditorium, Accra. So everyone is invited. In the morning, we'll be having a psychosocial moment, just as those are the various regions. So far, the whole 16 regions have been visited. We've been through all regions. And the grand finale is at UPSA on Saturday, 22nd of November. By 9 a.m., the program will start. So we expect to see you all over there. So the first session of the program will be having a psychosocial moment where we engage. I will be there. So let's meet in person at UPSA and the other members of the e-counseling team. Rita Wahin says, I hope to see more. Thank you, Madam Rita, for joining us. And I want to thank everyone who also made time to join us today. I can see my own boss, Ike Mawena. Thank you. You didn't see me today because I'm in Accra.